Senescence and cancer. Wait, what is senescence? So today we are going to talk about the groundbreaking research that is leading us to potential therapies for liver cancer in patients. This research was done by Tim Gretton and his colleagues at the National Institute of Health in Maryland. The research is called Distinct Functions of Senescence-Associated Immune Responses in Liver Tumor Surveillance and Tumor Progression. Say what? Never mind that. We're not going to look at this complicated title because all it is really saying is that they found new information on the link between senescence and cancer. So what is senescence? Senescence is simply when a cell stops dividing. Healthy cells are normally undergoing mitosis and dividing in order to produce new cells. However, every once in a while, a cell stops dividing because it knows it's cancerous and therefore harmful to the body. This is called senescence, and it is a very important function because we know that tumors are created when cancer cells can't stop dividing. So these damaged cells basically know that they have the potential to turn into cancerous cells and eventually form tumors. So when they undergo senescence, they secrete certain proteins called cytokines, which activate the immune system. This results in T cells and macrophages to come in and wipe out the damaged cell. And scientists call this senescence clearance. Obviously, this is extremely important because it protects our body from these damaged cells eventually forming tumors. However, sometimes when these senescent cells secrete proteins, the immune system is suppressed. This is bad, right? Now the potentially cancerous cells are not able to be wiped out by senescence clearance. So why would senescence cause cells to release proteins that do opposite things? One being activating the immune system to wipe out cancer cells, and the other to suppress the immune system. This is the question that the researchers sought to answer. So what did they find? Well, these scientists investigated cancer in the liver. So from here forward, remember that this information applies to liver cancer. Well, they found out that senescent cells secrete a protein called CCL2 that recruits immune cells to come and kill it. Therefore, CCL2 is a good guy. The researchers confirmed this by creating knockout mice that failed to produce CCL2, and they all developed cancer. However, the researchers found when and why this system fails. This system fails if tumor cells are already in the environment of the cells undergoing senescence. How are these tumor cells there? Well, they have arisen from mutations that have given cells the ability to bypass senescence, and therefore they rapidly divide. So remember that CCL2 turned on the immune response? Well, these tumor cells have the ability to take this immune response and turn it into an immunosuppressive environment. This is because they want the senescent cell to become cancerous and to come join them instead of being killed. And now the CCL2 is a bad guy because it is creating more and more of this immune response, which is just being turned into more and more of an immunosuppressive response by the tumor cells. It's like CCL2 is trying to do a good thing, but the tumor cells are turning it into a bad thing. Therefore, if a patient already has liver cancer, it may be effective to give them a drug that blocks CCL2 from binding to its receptor. We would call this an antagonist. And this would stop the senescent cells from recruiting these immunosuppressive responses, and therefore lessen the chances of cancer growth. This is possible because drug companies have already created these antagonist drugs for other therapeutic uses, such as treating multiple sclerosis and atherosclerosis. These drugs are currently in clinical trials right now, so maybe we will see them used more often in the future. Until then, This gives us potential to fight liver cancer in the future. Thank you for watching, and please remember to science responsibly.
The liver is an amazing organ. Its capacity to heal is a silver lining for patients undergoing surgery to remove cancerous tumors.
Although it's vitally important and you can't live without your liver, you can remove up to 80% of a normal liver safely with low mortality rates, and the liver will actually grow back to normal size.
Surgical oncologist Mark Bloomston says this regenerative ability allows doctors to reoperate multiple times if necessary. It also opens the opportunity for advanced techniques, staged procedures involving the use of chemotherapy.
We can put radioactive beads into the liver. We can do procedures to trick the liver into thinking it already had surgery, so the good side will start to grow and advance so we can take out more liver at the time of surgery.
In the coming decades, doctors hope the number of liver cancer cases in this country will drop. Hepatitis C is a driving force behind this disease, which is also impacted by alcoholic cirrhosis and morbid obesity. These are lifestyle issues which can be addressed through awareness. Until then, advanced techniques offer the best chance for a cure.
These tumors have to be removed to be cured. So if you can at least increase the number of patients eligible for curative therapies, by definition, you're going to get more cures.
A dangerous and often deadly disease, surgeons are using advanced operations to help patients outlive their liver cancer. For Lee Memorial Health System, I'm Amy Osher.
Namaskar. Liver is the largest organ, one of the largest organ of our body. The largest organ is skin, and it is a detox organ by itself. It detoxifies your blood and also helps in digestion. When we say detoxifying liver, means that we should see that liver function much healthier way now. Liver doesn't accumulate toxins, only throws out the toxin. Most of the times our liver gets damaged because of alcohol, because of excess of medicines, because of some infections, and eating high calorie diet. For the efficient functioning of liver and to protect liver from damage, here are few ways which you should keep in mind. First, turmeric. Turmeric is a wonder spice. It can really heal liver inflammation. It helps in boosting enzymes that can remove dietary toxins from the body and thereby reduces the load on liver cells. So, either you consume turmeric at night by putting turmeric in milk and taking it, or in the morning, take little honey, put turmeric, make a paste and eat it. Second, milk thistles. Milk thistle is a wonder drug. It really shows quick recovery in the liver ailments. It helps in preventing the damage to the liver cells. The active ingredient in milk thistle is silmarin. It is a compound which has strong antioxidant and anti-inflammatory property. This is a plant which is not easily available in India, but nowadays you can get this in a capsule form and can be taken twice a day for a month, 200 mg capsule preferably, or you can even have its seeds in tea form. Third, garlic, lasan. The sulfur compound in garlic activates liver enzyme, which helps in flushing out the toxins from the body. It has high amount of compound like allicin and selenium, which protects liver from any toxic damage. Take 2 garlic cloves at night before going to bed. You can add garlic in your cooking. Fourth point, follow right food habits. According to Ayurveda, the digestion and metabolism in our body are carried out by 2 different fires. These different fires are called as Agni and Pitta. Liver is a fiery organ. Anything fiery or hot is not good for liver. Alcohol, caffeine, tobacco, hot spicy food, non-vegetarian food, chemicals in the packaged food and medicines, they are all not good for liver as they are all fiery. According to Ayurveda, certain things like aloe vera, neem, amla, karela, haldi, all these things are used for boosting liver health. Avoid even processed foods and sugary drinks because they all have trans fat. Not good for liver, it will make liver fatty. If you already have fatty liver, then minimize the consumption of dairy products. Consume good fat like almond, walnuts, seeds like pumpkin seeds and sunflower seeds, avocado. All these are wonderful. Eat more fruits, more vegetables for fiber, as fiber reduces stress on the liver. Especially consume green leafy vegetable like spinach and methi. Green leafy vegetable contains compound which naturally detoxifies your liver. Beetroot, carrots and apples are also good for liver. Fifth, most importantly, yoga. Yoga techniques are the best means to enhance your liver function. Here are few techniques which you must do every day. These asanas can give a nice compression on liver and burn out excess liver fat. They are Yog Mudra, Bhujangasana, Dhanurvakrasana, Paschimottanasana and Surya Namaskar to burn the excess fat. Pranayam, like diaphragmatic breathing, should be practiced every day, rather 2-3 times in a day. Pranayam, so important, gives good oxygenation to your body, and basically pranayam, which is diaphragmatic breathing, should be practiced really regularly, every day, 3-4 times in a day, and that would work wonders. One of the major cause of liver problem is alcohol. Alcohol damages liver cells completely, and so what should be done? Avoid alcohol. What makes you really high, a very calm, composed, happy and energetic? Walking. Walk 5 to 6 kilometers a day every time. See to it that you do asanas regularly. See that you eat the right type of food in your system, and try and see that you become more useful to others, not living for yourself with your own comforts and with your own little soft sofa with you. Try and see that you become more active, helping yourself, helping others. So when you start living this type of a life, you are really going to enjoy your life. Your liver would be really safe and you will enjoy a good health. Namaskar.